Disease is the condition in which the organs or the organism is abnormally related to internal or external influences, which relates to our welfare physically, mentally, and spiritually. Disease is, therefore, a general term signifying any variation from normal, either in functions or tissue or both. Mark this one. An alteration of function cannot occur without a corresponding change in the structure of tissue. An alteration of function cannot occur without a corresponding change in the tissue. Rador said this in 1843. If any organ is deficiently supplied with nervous energy or blood, it functions immediately, and sooner or later its structure becomes deranged. And by those functional aberrations and those structural alterations we name disease. The physiological and pathological and microbiological ramifications of a disease, original strangling, are not the cause of the disease, but the result. They are simply manifesting the disease. Can you get the depth of that? The spurs on the spine, spondylitis, are not a disease. They're the result of the malalignment of the vertebrae. Can you see that? When strep flourish in your throat, that's not a disease, because you all have strep in your throat right now. It's simply a manifestation of malfunction in the mucosa of the throat that allows them to proliferate, and the same is true of the pneumococcus. Every one of you has one now. A goodly number of them, the little sweepers of the mucosa. They're necessary to our environment. But when the mucosa become terribly malfunctioning in respect to producing things that allow them to proliferate, they proliferate trying to get rid of it, and then what do you have? Pneumonia. Think of it, chiropractor. This is revolutionary. Even the immune system is controlled entirely by the nervous system. Listen to the words of Bernie Siegel from Love, Medicine, and Miracles. Bernie Siegel, now the cancer surgeon, MD, PhD. The immune system consists of more than a dozen different types of white blood cells concentrated in the spleen, the thymus gland, the lymph nodes, and patrolling the entire body through the blood and lymphatic system. They are divided into two main types. One group, called B cells, produce chemicals that neutralize poisons made by disease organisms while helping the body mobilize its own defenses. The other group, called T cells, consists of killer cells and their helpers, which destroy invading bacteria and viruses. Recent research has shown heretofore unknown nerves connecting the thymus and the spleen directly to the hypothalamus. Other work has proven that white blood cells respond directly to some of the same chemicals that carry messages from one nerve cell to another. The immune system, then, is controlled by the brain, either indirectly through hormones in the bloodstream or directly through the nerves and the neurochemicals. What are those messages called? How many of you can go back in our philosophy and tell me right now what those messages are called? Are they nerve impulses? No. What are they called? Mental impulses. That's it. Transudation through the serous circulation. D.D. Palmer stated, they don't even need a nerve pathway. That's what they're talking about here. But they're controlled by the brain. One of the most widely accepted explanations of cancer, still the most prevalent explanation, I might say, the surveillance theory, states that cancer cells are developing in our bodies all of the time, but are normally destroyed by the white blood cells before they can develop into dangerous tumors. Cancer appears when the immune system becomes suppressed and can no longer deal with this routine threat. It follows that whatever upsets the brain's control of the immune system will foster malignancy. Siegel quotes the statement of Everson and Strykar in their medical textbook, Pathological Anatomy. And they state the link between the development of tumors and the central nervous system has so far been very little studied. Neat. And why haven't we studied it? Why have we left our philosophy? Because we wanted to be accepted. Pews. That's right. We wanted to be accepted. It was the ACA that started the first conference on spinal manipulation. I want you to remember that, you members of ACA. And they still hold it today. And hold that the term manipulation is synonymous with adjustment, and it is not. Manipulators do not stop. The competent chiropractor knows where to adjust, when to adjust, how to adjust, and when to stop. The words of B.J. Paul. Manipulators do not stop. It's a treatment to them. Can you take a lesson from the dentist? Who likes to go to one, by the way? Sometimes we have to beat our patients away from the door. They want to keep coming back. Who wants to go to the dentist? You know, they don't, but they do. Why? To be drilled? Turn of the century, why did you go to a dentist?
Pain.
Cavity, pain. Oh, yeah, hurt. Why do you go now?
To prevent pain.
And when the dentist says, you don't need to be drilled today, you say, get out the drill me, that's what I'm paying you for. But yet each and every one of us at times assume the patient wants us to thrust. Feels so good, feels so good. One advantage of my omnidirectional non-specific all-force technique is when I tell them they don't have to have an adjustment, they say, thank God. Tell them they're clear. They should want to know they're clear. They should come into our office and say, I want to be checked to see if I'm clear. I'm here on vacation, and my chiropractor down there said drop into your office because you would check me to see if I'm clear. We're not providing them a therapy. That's medicine. That's osteopathy. That's homeopathy. That's acupuncture. Name me any other form of alternative care that is not a therapy other than chiropractic. Not one. You see the difference? Now, you don't have to get up on a soapbox and preach like a little barge here to your patients, but you have to have the confidence with each and every one of those patients to start bringing the broad spectrum of our care forth through them. The three famous words that you should give to every patient once they say, gee, doc, I'm feeling so much better, I'm so happy I came here. What are the three famous words you should say then? That's great. But how's the family? Don't forget that. How's the family? And then it pours out from them. The problems with their kids, their grandkids, their wives, their uncles, their aunts, the whole blasted family. It starts flowing out. How's the family? Will bring forth that type of response from a patient. And it reminds me of the words of Marinus, the medical anthropologist of Canada, who wrote an article way back in 1980 for the Canadian Chiropractic Association. Dr. E.A. Marinus, Department of Sociology, Simon Fraser University, British Columbia. At the cultural level, chiropractic has continually revised its theoretical models, more as a change of orientation than a basic content. D.D. Palmer included both the metaphysical and the mechanical in his original theory of chiropractic. Modern chiropractic theorists are also metaphysical and mechanical. But there have been some significant changes in the balance between these two dimensions. Palmer